You've probably heard ovarian cancer called a silent disease. And that term, it suggests this quiet, undetectable threat, right? But what if that's not the whole story? Today, we're going to pull back the curtain and uncover the subtle but absolutely crucial signals our bodies might be sending us.
So, that's the big question we're tackling today, isn't it? The goal here is to learn how to listen just a little bit closer, to learn how to transform what might seem like random whispers from your body into clear warnings that could, quite literally, make all the difference.
So, what are we really talking about here? Ovarian cancer starts in the ovaries, those two small organs that produce really important hormones. Now, it gets that scary silent killer nickname because the early symptoms are just so, well, they're sneaky. They're so easy to dismiss as just stress or getting older or maybe something you ate.
And to really understand why this is so important, let's just look at the numbers for a second. The lifetime risk for a woman to develop ovarian cancer is about 1 in 78. And look, this isn't just some abstract statistic. For many of us, this brings the topic right home. The stakes here, they're incredibly high. Just in 2021, nearly 14,000 women in the US lost their lives to this disease. That number alone just underscores how urgently we need better awareness and, crucially, earlier detection.
But here's where it gets really important and honestly hopeful. While the average 5-year survival rate is around 35%, that number jumps up dramatically when the disease is caught early. This is exactly why being able to recognize these signs is so incredibly vital.
Okay, so let's get into the real meat of this, the 10 key warning signs. And I want you to think of this less like a scary medical checklist and more like a guide, a way to help you decode what your body might be trying to tell you. All right, first up, bloating. And, we all get bloated from time to time, especially after a huge meal. But the key word here is frequent. We're talking about a persistent feeling of being full or swollen that just keeps happening, and it's not just tied to what you ate for dinner. Signal number 2 is a dull, lingering ache in your lower back or pelvis. It's not like a muscle strain that you feel getting better day by day. This pain just sticks around. It might even spread toward the groin area, but the real telltale sign is that it just doesn't seem to go away. Next up, let's talk about constipation. Now, this isn't necessarily about your diet or not drinking enough water. In this case, a growing tumor can literally put pressure on your colon or rectum, which makes everything, well, harder to pass. This can also add to that constant feeling of being full we just talked about. Number 4 is gradual fatigue, and this one is so easy to ignore. It's not like you wake up one day feeling exhausted. It's this deep sense of tiredness that just slowly creeps up on you over time. It's the kind of thing we're so quick to blame on our busy lives or just getting older, but it can be a major signal from your body.
And next, there's persistent abdominal discomfort. The pain doesn't have to be a 10 out of 10. In fact, it can be pretty mild, just a dull ache. The thing to remember, the absolute key, is that it's persistent. It's there day in and day out, and that's what makes it a red flag.
Okay, picture this. You sit down to eat, you're hungry, but after just a few bites, you're stuffed, like Thanksgiving full. That's our 6th sign. It can happen because a tumor is physically pressing on your stomach or because of fluid buildup, basically leaving less room for food. This is kind of like the constipation issue we just talked about. It's a mechanical problem. A tumor can actually press against your bladder, creating this constant, urgent feeling that you have to go right now. The key here is that it's a new and noticeable change from what's normal for you. Now, let's talk about your menstrual cycle. We all know cycles can be weird, right? Especially as we get closer to menopause. But we're not talking about small fluctuations. We're talking about really sudden, big shifts. Since the ovaries are in charge of this whole process, it makes sense that something wrong there could throw the whole system out of whack. 9th on our list is having a hard time eating or feeling nauseous a lot. This isn't because of something you ate, it's a persistent upset stomach feeling. And this one is a really insidious sign because it often shows up once the cancer has started to spread, which is exactly why catching those earlier signals is so critical. Okay, if you take away just one thing from all of this, let it be this. The critical difference is all about frequency and persistence. Having an off day here and there, something you can trace back to your diet or your cycle that goes away on its own, that's just normal life. But a symptom that's showing up almost every day and it sticks around for a month or more, that is the warning sign. That's the signal you need to tune into. So knowing the signs is a massive first step. But what do you do with that information? Let's talk about turning all this knowledge into action. Because knowing is one thing, but doing is everything. So if any of this is ringing a bell for you,
and these symptoms feel persistent, the path forward is actually pretty straightforward. It starts with a conversation. Just talk openly with your doctor. From there, a common first step is a simple abdominal ultrasound. It's totally not invasive. They might need more tests after that to get the full picture, but the most important part is taking that first step.
And that really brings us back to where we started. Maybe a silent disease isn't so silent after all, if we just learn how to listen. The real question isn't whether our bodies are sending signals, it's whether we're paying attention. So I'll leave you with this thought. Could learning to listen to your body's whispers actually save your life?